So we recently released a study that looked primarily at the prevalence. That's a snapshot of how many people in Australia have MS, and also looked at the costs of MS, so an update from our 2017 report. So we've done this in 2010, 2017, and we're in the process of starting this again, a whole round of things now, so questionnaires, reassessing prevalence, and that should be released next year or so. Hands up, please, anyone who's part of the AMS-LS. Fantastic. And of those, who filled out the cost diary in 2017, 2016, 2017? One. So yeah, that's about the percentage. So of about 2,500, 3,000 people we have in the AMS-LS, probably only about 400 people fill out the cost questionnaire. Part of that is because in the past it's been paper-based and quite complex. The good news is that we're now putting it online, so it's going to be a lot easier, and the questionnaire has been simplified. So after this meeting, if you can go over, please, anyone who's not been enrolled in the AMS-LS, go and sign up. And if you haven't signed up for the cost questionnaire, please go and do so, and you'll find out why that's really, really important. Okay? Oops. Too dramatic. So, as I said, one of the main aims is to try and update the number of people who have MS in Australia. So that's a snapshot of how many people have this disease. And we used a method that I developed about 10 years ago, where we looked at prescriptions for MS-specific drugs, so DMTs that are only used to treat MS. And so if we can look at all those prescriptions, which are readily available online, and those numbers, we can calculate the number of people who are taking DMTs for MS. We then put that together with what percentage of people are taking DMTs, and then we can calculate that number of people with MS. So when we did that, we found out that the number of people with MS in Australia is about 33,300 or so. Plausible range is between 30,000, might even be up to nearly 40,000. If we look at that as a percentage of the population, it's 131 per 100,000. Okay? So, that's pretty big numbers, but what does that mean over time? So what we've seen over time, and if we just use that per 100,000 number, that number's increased and fairly dramatically from when we did it in 2010, when it was 95 per 100,000. It crept up to about 104 per 100,000 in 2017, and now it's up to 131 per 100,000. I can see you all asking why. Why is that so? So the prevalence increased by 30%, that raw number of people, the 27,000 up to 33,000 from 2017 to 2021. This increase is accelerating compared to 2010 to 2017. Why is this happening? That's a really good question. And part of it is that people are living longer. So people with MS are living longer. So obviously the number of people alive with MS is going to increase. There's improved detection, identification, earlier diagnosis of MS. Okay, that's contributing. But there are other things that are actually probably the incidence, so the number of new cases is increasing as well. And that may be things like the delayed effect of the slip-slop campaign from the early 80s and so on, where people are kind of discouraged to go out in the sun and getting less vitamin D and UV exposure. There's obviously increasing levels of obesity and overweight in the population, and these are risk factors for MS. Things like women having fewer babies and at a later age. These are all contributing to that increased risk of MS. Maybe increased female smoking rates, or a whole combination of those things put together. You can probably ask Bruce Taylor about that. He's more of an expert on that reason. But certainly what we've seen is that number of people with MS is increasing. So the second part of this study was to look at the costs of MS. Cost of illness, so we looked at the cost of illness of MS in 2017. and we just inflated those numbers, and we multiplied that by the newly estimated number of people with MS. So, small letters and small font here, but what we see is that the per person costs of MS increased to nearly $74,000 per person. A lot of those are from direct costs, so the things that we have to pay money for, costs of medications, costs of going to the doctor, costs of buying new equipment, costs of refitting your home, all of those kind of things. So nursing home costs. Then there's indirect costs. Indirect costs are due to lost productivity, so not being able to go to work due to your illness, or when you're at work, you're less productive while you're at work. Now, if we multiplied that 33,000 people with MS times 73,000, then we can see that the total cost of MS in Australia is about $2.5 billion in 2021. And that was compared to 1.75 in 2017. So these numbers are high and increasing. What we also can see is that when you have MS, the costs increase quite dramatically as your level of disability increases. So from the level of people with MS with no disability at all, it's about $32,000 per year, and that compares to someone in the general population whose costs are only about $8,000 per year. When you move up to mild disability, it's nearly $60,000 per year. Moderate disability, $82,000, $83,000, and when you have severe disability, it's about $123,000 per year. And on the other hand, your quality of life goes down. So if we measure it on a health utility scale, on a scale of 0 to 1, where 0 is equivalent to being dead and 1 is perfect health, your health utility goes from 0.8, which is about the same as the average population if you have no disability, and then drops down to 0.48, which is quite a dramatic decrease in your quality of life. Could be equivalent to someone with terminal cancer almost, or with multiple amputations from diabetes. So, you're probably sitting there thinking, well, thanks for that, Captain Obvious. Of course, the costs are going to go up as my disability goes up. I have to pay for, or someone has to pay for a wheelchair. Or I have to modify my home. Someone's got to pay for the disease-modifying therapies, which can cost up to $100,000 per year. So, of course, the costs are going to go up and be high. And, of course, my quality of life goes down when my mobility decreases, or I can't sleep at night, or I'm fatigued at 2:30 in the afternoon. So, that's obvious to people in this room, but in Australia, generally, the average person doesn't have a clue about this, and the average politician certainly doesn't know that these costs are very high and impactful on people's quality of life. So these reports are very useful to increase that general awareness of the impact of MS, and to make politicians aware of that impact on a financial basis, and can therefore go to politicians and say we need more money for research. We need to improve the NDIS. We need to just generally use to lobby politicians and increase that awareness. So following our report release, I think it was earlier this year, there's a lot of media coverage, so both in standard media like TV and radio, and Bruce and I were on the radio and did TV interviews and so on, all across Australia. Online, there are a lot of news stories and so on in the print media, and the podcast, The Raw Nerve, that Rowan runs. So that went, the total audience for all of this kind of media coverage is estimated to be nearly 400,000 people. Probably more importantly, rather than just raising that general awareness, that economic impact of MS study that we did in 2010, that was used to lobby for the NDIS, which didn't exist in those days, but certainly the information and these cost data and so on were used to lobby for the implementation of the NDIS. The report that we generated and released in 2017, that was launched at Parliament House by well, 3 days, I'd like to say I was responsible for this or not, but Scott Morrison became Prime Minister 3 days after presenting this report or releasing this report. And don't blame me either, so. And it's been used in a lot of policy translation documents. So just about every submission to the PBAC, that's the body that decides whether or not a new medication should go on that reimbursement list. So a lot of the new DMTs, are they good value for money? The cost effectiveness, all of those have to undergo an assessment process, and part of that process is being presented with information like this. You can say that, well, if we can reduce that progression from no disability to mild to moderate, we can actually save money. So very important in lobbying politicians. And the latest report, which was just released not long ago, had all of those things, as well as the pre-budget submission for the recent budget. So these things take a lot of time and effort to complete. As those of you who filled out these cost diaries, it's going to be a lot easier because it's going to be online. Takes a lot of time and effort to analyse and interpret, so thank you very much to the AMSLS team who clean the data, handle the data, input the data. It's very useful in raising awareness of MS, okay, and obviously very useful in lobbying government for reimbursing new and expensive medications for MS, and importantly raising or increasing funding for research in MS. So, the 2017 report was a real keystone in obtaining the $10 million MRFF funding for our MS flagship. So Julie Campbell, who spoke just a minute ago, she is a main contributor to this. Also, thank you to Ingrid and Bruce, and Kirsty and the AMSLS team, and everyone else, people with MS who are part of the AMSLS, who contributed to the cost diary. Thank you to MS Australia for their funding. And I may just call on Rowan. He's going to just give us a bit more detail of how these reports are actually used, if that's okay. Thanks, Rowan.
Just very quickly, I used to work for politicians. I spent 7 years working for politicians, including a couple of health ministers, and there used to be a little phrase, if there's no data, there's no problem. So you didn't have to spend any money, you didn't have to take any action, you didn't have to do any policy change. But when data is put under the nose of politicians, they take note. They take more note. You can go and see a politician and explain to them what you need to do, and here's the evidence. But they take a lot more note if it's on the front page of the newspaper or on the top of the ABC TV News Bulletin. I can assure you of that. So a report like this is so incredibly, fundamentally important to good advocacy. But it's also important to raise community awareness. It helps us tell the story about MS. It also puts a sense of urgency around the agenda. And I can tell you that the reports that have been produced by the Menzies are the envy of many other MS organisations around the world. I'm really surprised at how there's a real lack of good prevalence data in other countries. The Americans don't really know how many people in America have MS, and when I asked the CEO there, they say, well, different states collect different data in different ways. We don't really know, but we know there's a sharp increase. And so our ability to produce this really excellent data, get it under the nose of politicians, is helping us enormously to drive change, to lever more funds for MS research, to influence the NDIS, aged care, disability support pensions, and so many other areas. So it's a really fabulous job, and I really urge you to give Andrew and his team another round of applause.